environmental medicine. Dr. Nagy comes all the way from Martha's Vineyard, and she's graduated magna cum laude from the University of Pennsylvania, and then again magna cum laude from Cornell Medical College in 1986. After that, she did a surgical internship and then became enlightened and started doing emergency medicine. That's my field too. And she did a residency in emergency medicine, worked in emergency medicine in Los Angeles. But unfortunately, in the year 2000, she became very ill. And it took her, I think, a long time. She'll talk about her story, I think, about to get better. But she was diagnosed with a multiple chemical sensitivity. She had Addison's disease, which is loss of cortisol, adrenal support in the body. She had mitochondrial myopathy, which is basically when the cell energy production doesn't work, and dysautonomia, which is when the autonomic nervous system doesn't work. The things that anyone with a chronic illness suffers from. So she's going to be enlightening us today about environmental impact on our health. Her story is really interesting. It actually inspired Nightline to interview her this year, where they did a special report on her. She's had many newspaper, magazine articles written about her story. She's currently the president of the Preventive Environmental Health Alliance, which is a group that's really focused about educating health practitioners, medical students, physicians, and the public at large about the problems with environmental illness. It's a problem that's estimated that 75 million people suffer from, and they're often labeled with chronic illness, autoimmune disease, but in fact the basis is often environmental, so we're here all to learn that. Basically, it's a combination of genetics, a weakened immune system that makes us more prone to that, and that's why we've invited her to speak with our group, so we start to understand more about our own physical elements. In reviewing her CV, I was very interested by her publications. Some of them have very interesting titles. For instance, Women's Health is Environmental Health, Mold and Marital Discord, The Salem Witch Trials All Over Again, and Crazy for Mold. So I think we're all going to relate well to this talk, and it's a great pleasure to welcome Dr. Nagy. Thank you.
Thank you very much for that great introduction. I always have to figure out exactly how to start in. So, the title of the talk could be many different things, but the bottom line is I'm trying to give you a framework to understand if you're sick as a patient or you're a practitioner, how to approach a sick patient in order to get them well. Because that's what everybody cares about, is being healthy, having your family be healthy, and trying to get to the bottom of things. So we don't want to spend a fortune getting well. We want to do it in an economically sound fashion, and we would like to have physicians on board that we see and not have them out of the loop. I feel that one of the problems is that traditional medicine isn't really understanding where we are when we get sick, and when we find out how to get well, they're not really hearing us or believing us that we were ever sick in the first place. So I titled this talk, Environmental Triggers of Chronic Disease and Chemical Sensitivity in the Average Person. So this really applies to all people, healthy or sick. It's not just about chemical sensitivity. Nobody wants to have Lisa's disease. I can tell you that used to be it. People will veer away and say, I don't have your problem, I'm not as sick as you. But everybody has a little something that can be improved. So whether you find yourself ill or you're a well physician and you want to help patients, there'll be something in this talk, hopefully, to persuade you that this needs to be taught in medical school now. So I'm going to touch upon my story, which is typical of many people's stories, so it's not just about me, but really of lots of people like me. And I'm going to give you the basic signs and symptoms that we may all experience of being mildly environmentally overloaded. If doctors knew these signs and symptoms, I have a flyer in the back which lists the signs and symptoms that are common. Then the doctor would identify that the patient has this problem and potentially refer them to a book to read or a practitioner to see that can tease apart the details. You can get neurologic, mental, and immune conditions, and I will explain some of the data linking environmental exposure to specific conditions. But it would take hours to really go into each condition and all the data for each one, so I'm just going to touch on it. I'll show you a few articles documenting different aspects of ill health from mold and mycotoxin exposure, and a summary of the environmental medicine approach to the treatment of chemical sensitivity, which is the same really as environmental illness. So EI, or I guess you could call it CS, is the same condition. the multiple is dropped. So we didn't do well with legal lawsuits using multiple chemical sensitivity. Although some of the patients hold on to that term, it's sort of passé. And the American Academy of Environmental Medicine, which I'm on the board of directors now, but I'm a member, we don't really use the term multiple chemical sensitivity anymore. The courts said it doesn't exist as a real condition, and it's just not been found to be useful to carry that word multiple anymore. And then I have a plan for national education. So here's some examples of environmental triggers of neurologic, mental, and immune illness. So some cases of Parkinson's can be caused by mold and mycotoxin exposure, or even manganese toxicity has been proven in the literature, and pesticide exposure. So not every case of Parkinson's or a Parkinson's-like syndrome will have the same cause. Some of it will be more genetic-based, some will be more environmental exposure-based. Maybe there are three things adding together to make the person have this problem. But it's not one cause, one disease, which is the way we usually think of things in medicine, and then there's one pill, one treatment, and it's just not that easy. Lou Gehrig's, or ALS, has been published at Harvard to be caused by formaldehyde exposure. In some cases, in my experience, it's also been linked to mycotoxin exposure. People with Lou Gehrig's only usually live a couple of years in most cases. Brown University, a doctor named Shanessa, published that there's a 40% rate of depression when living with in a house with a mold problem. And they've studied 3,500 people and interviewed them. They didn't measure mycotoxins, but they asked people whether they had a significant mold problem in the house, and the rate of depression was shockingly higher than Dr. Shanessa had anticipated. Arthritis is often related to food allergy or intolerance, and this is commonly known by environmental physicians. So when you see somebody with an inflammatory condition, an autoimmune disease, you want to look at the diet. And sometimes the patient will be stimulated to become sensitive to foods because of mold exposure or because of pesticide exposure. So they may have one thing, a big hit with a toxic exposure, and then that leads to a downfall in the tolerance of foods and chemicals everywhere. Okay, so I'm going to have two people speak today because really putting people on camera is very convincing for other physicians to see in case anybody sees this in the future. So here's the case history of Olga, who's in our audience, and she was demonstrating some common signs of environmental illness. She's a 60-year-old female with an 8-year history of steroid-dependent, quote, rheumatoid arthritis. She has a history of living in a building that made her ill from mold, she thinks. She left the home and her belongings and built an allergy-free, non-toxic home. Her medications included prednisone, 12 milligrams a day, and her exam revealed higher heart rate and blood pressure on standing from Lyme, with a change in the heart rate going from 98 to 72 when she would lay down. She had sausage-like swelling of the joints of the hands and enlarged tender knees and ankles, and quite a bit of difficulty walking and going upstairs and really using her hands for things like cooking or cutting vegetables. She had lower extremity edema that was pitting, and she had no smell of mold in the clothing at the time that I examined her. Her workup and 5 days of treatment with intravenous vitamins, progesterone, later testosterone cream, cortisol, which is hydrocortisone is the medication, 25 milligrams a day, given in this method of 15, and then in 4 hours 10, and then in 4 hours 5 milligrams. And she decreased her prednisone by 1 milligram a week after she initiated some of these interventions. She was placed on a 4-day fast on mineral water in glass bottles only and sweet potatoes, and then later started the rotational diet. And this is written up by Dr. Randolph in a book which I would recommend everybody read, and it's called Alternative Approach to Allergies. And Randolph is the father of environmental medicine, and he discussed the relationship of food allergy to inflammation and also to mental health. So sometimes we can eat a food that'll get us to react to the food and we'll sleep or get tired or yawn or feel stimulated and hyper. And this is really big in children. And Doris Rapp is a famous author who's written about the effect of foods, like allergic foods, on kids and how they can be hyperactive or uncooperative or changed, like Dr. Jekyll and Mr. Hyde, just from eating something that they're sensitive to. And this is not IgE-related allergy. This is an allergy mechanism that may be IgG or also other ways of developing a sensitivity that we just haven't pinpointed. There's a dramatic reduction in joint pain and swelling and observance of which foods and supplements give her the joint pain. She stops eating these foods completely once she figures out that food is triggering her arthritis. Also, her postural orthostatic tachycardia syndrome is treated with Minidrine, and a tilt table is ordered. We'll go into detail about POTS and about dysautonomia, but I thought this was a good summary, and now I'm going to have Olga come up and just speak for a couple of minutes about her experience. Olga, you want to come up?
Good afternoon. I'm Olga, and I was diagnosed with rheumatoid arthritis in 2004. I was put on progressively stronger and stronger, that is more toxic arthritis, rheumatoid arthritis medications. And alas, even the over 20,000 a month infusions of Orencia did absolutely nothing for me. Last fall, all pain medication and in fact all other medications stopped working for me. And I was in the midst of a severe RA flare-up. And so I was struggling with severe pain, and it was basically debilitatingly immobile. For example, it took me 3 hours just to get dressed in the morning because my joints wouldn't bend. And so in my desperation, I finally got Dr. Nagy's name, and as much as I don't like roads, I actually ventured to Martha's Vineyard, and it was well worth it. I never accepted rheumatoid arthritis as my primary diagnosis because I did enough research to understand that I was too old to get it when I did. When I went to visit Dr. Nagy, she first interviewed me for about 3.5 hours about everything. What I ate, the quality air I breathed, what kind of a house I lived in from birth to present. And by the time that this interview ended, where she had all my medical and environmental history, she said, well, I think that you have mold poisoning. And then she ran a bunch of tests, and in fact, every test that came back confirmed her diagnosis. So as she pointed out, she started treating me pretty much immediately. And about a month into the treatment, I finally sort of said, no, maybe I should try a dietary change. And by the way, the correct diet is fasting with non-chlorinated bottled water only. But since I was on prednisone and hydrocortisone and had digestive issues, I couldn't take my medication on an empty stomach. So I asked for her advice, and she said either I some sweet potatoes, which every you eat less, and for me it was sweet potatoes. The first day, I didn't feel very much change. There was a little bit of sort of better feeling in my legs. But by second day, I could actually bend my knees, I could stand up, and my lower part of the body no longer had RA. By the third day, the swelling of my fingers, where they were about that thick, became about half, and again, my hand was about that high in these joints. And by the fourth day, all of my rheumatoid arthritis symptoms were gone. After 8 years of living with progressively more excruciating pain, which eventually wasn't controlled by any pain medication, I woke up, I could hop out of bed, I could use the staircase, I could actually move my hands and fingers, and I was astonished to discover this difference. So then Dr. Nagy also referred me to Dr. Overberg, who's a nutritionist in Dallas, and who has published a wonderful book called Bon Appetit, which teaches you how to get on for the rotational diet. And it also teaches you about food groups and whatever, and hopefully it will be available in Amazon in about 6 months. And so I started on the rotational diet, and right now I can still trigger my RA symptoms anytime I get exposed to anything that my body reacts to, and it can be food or it can be environment. I no longer can go to Home Depot because as soon as I do, I immediately start swelling up. I'm delighted to report that for me, the RA symptoms are completely controllable by controlling my food and position as I am. And what I would really like to see is that for the sake of all of those who have environmental illness and may or may not know it, that the field of environmental medicine becomes generally accepted in the regular medical practice. And if you see a patient who has lots of seemingly disjoint symptoms, you don't send them to a psychiatrist, you send them to an environmental medicine specialist. Thank you.
Thank you very much, Olga. And I have a slide on Janet. So Janet is everybody's really 16-year-old female with constant headaches. 20 years ago, she had mold exposure and left the home with a mold problem. And her children, who were raised in this home, are now 17 years old, and twins, fraternal twins. Both of her sons have, I'm generalizing a bit, tachycardia, fatigue, low adrenal function by ACTH stimulation, ADD symptoms, and a brain fog, and they do better on midodrine. Here is Janet to discuss her experience.
Hi. We moved into our home about 24 years ago, and it had the typical slightly musty basement smell that was usually relieved with a dehumidifier. And I began having headaches after the birth of these guys, who are now just 18. And 12 years ago, we renovated the house entirely. So we lived our days actually in the basement for the year of the renovation project. My headaches grew more frequent, and I experienced a lot of fatigue and stomach distress, along with an interesting phenomenon, nighttime foot and leg cramps. And my primary care physician just chalked it up to stress. Our two youngest boys, these guys, had chronic ear infections beginning shortly after birth in that house, and then they went on to develop a lot of these different chronic conditions, including dyslexia, ADHD, and severe school anxiety. One of them was disabled enough to couldn't attend school for half a year. And our two older boys had some severe, or several pneumonias and occasional asthma. A couple of winters ago, we experienced ice damming and a leak into the living room, and it finally caused me to think about mold as a possibility. And we got some testing done on the house and learned that, in fact, we had several areas throughout the house. It took us about 18 months. Serial explorations and remediation, which we have just finally completed. But during that time, the boys and I, or by that time, the boys and I had seen numerous conventional physicians who were offering symptomatic relief, and various integrative physicians who were looking for answers for us. But this is a tricky thing that a lot of people are not trained in. It's not the first thing that comes to people's mind. We did discover that the three of us all had Lyme, so we began treatment for that. And we also eventually made our way to Dr. Nagy. She found the boys to both have elevated body burden of mold, and also found them to have associated autoimmune conditions and adrenal insufficiency, which caused them to have dysregulated autonomic nervous systems, fatigue, and troublesome brain fog. So they're being treated at the moment. And when I started seeing Dr. Nagy, she referred me to a biologic dentist who measured, because by that time I was developing chemical sensitivity, and then a small portion of those people can develop electric sensitivity. And while we were renovating the house, we moved to an apartment which had enormous exposure to surrounding cell towers. And our own modem apparently was putting out a huge amount of radio frequency radiation. And I had developed one chronic unremitting headache for 10 months by the time I came to see Dr. Nagy. And so she sent me to a biologic dentist who measured my teeth with a voltage meter and found I actually had a current being generated by the different metals in my mouth. And my teeth actually had, produced a voltage. So I had the amalgams removed, and I converted the crowns to porcelain only. They typically have metal jackets inside, and again, the different metals are So that problem has gone away. We also got a non-wireless modem from our cable company, and we disabled the wireless features on our computers and electronics. We're living with numerous cords on the floor. My husband has been very understanding and patient about this whole thing. I have to really thank him so much for what he's gone through. And you know, you may know this by now. I see a lot of men in the room, but it's interesting that typically chronic illnesses like this are visited upon women in much higher numbers, and I guess testosterone has some kind of protective effect. But anyway, our men have to be very understanding, and I must say he's really learned an enormous amount and really come on this journey with me. So once we made all those changes, and with Dr. Nagy's supplementation, my headaches, stomach pain, and fatigue have disappeared. And they've returned recently because we've been dealing with some of our moldy items, so I expect I'll recover down now that we stopped doing that. Boyce and I are on our way to recovery now, and I have to say we probably could have been helped years earlier if all our different physicians' training had included taking an environmental history and looking for the root causes of our problems, or referring us to a specialist who would understand those root causes, like Dr. Nagy. And I have to commend her and say she's really a national treasure, because she not only helps people like us who have bounced around from physician to physician without answers, but she's also making time to try to train her colleagues and to convince people that really we do need that training right from medical school. So thank you.
So I no longer need to continue my talk. I'm finished. Thank you very much now. So I'll try to, I thought if I put those women first, that would make people who watch this video in the future potentially believe that there's a reason to watch the rest of the lecture and to learn more. Because unless you get somebody interested gutturally, they really believe that the patient's story is valid, they won't tune in, they won't be interested. So I'm going to give you as many facts as I can, as quickly as I can. And I'm sure you can catch the information later. I have PowerPoints on my website, which is lisanavy.com. I have a University of Pennsylvania lecture that I gave, and you're welcome to refer anybody to the website so they can watch that lecture and pass it around. And the idea would be to have medical schools teach an hour or two in the first year about this way of thinking. And I'm trying to make lectures available, for free. So who gets environmental illness or chemical sensitivity? 5% of the population is disabled from environmental illness. And then how can that be that nobody in medicine acknowledges it? It's very stunning. 15% of the population is moderately chemically intolerant. 30% of the elderly are chemically intolerant. And it's estimated that an additional 40% of the population is adversely affected by chemical exposure and is unaware that their symptoms are related, like somebody with rheumatoid arthritis or somebody with MS. So they may not even know that they're chemically sensitive if they're wearing a lot of perfume and using commercial detergent and fabric softener. It's called masking. It's all covered up. They can't even tell they're chemically sensitive. So you may think you are not, but if you live in a clean environment for 4 days, you'll unmask and show your colors and start to become sensitive. I think most people will unmask and become more sensitive a little bit. The first statement I said with, let's see if this works. Oh, I think I turned it off. So let's see, okay, so the first statement I made, 5% of the population is disabled by EI. This is not just me making it up. There are multiple studies conducted by government agencies asking people by polling how chemically sensitive they are, and this is what's been found. 5 and 15% are fixed numbers that I have not just made up. Anyway, the ratio is 4 to 1, women to men, for chemical intolerance, fibromyalgia, and chronic fatigue. Many psychiatric conditions may have environmental roots, and this is really big, and it sounds quite crazy, but the end point of untreated environmental illness is often bipolar illness. So after 5 to 20 years of somebody being environmentally ill, they'll speak quickly, they may be anxious, they may do things that bipolar patients do, and therefore when we go and present to a physician after we've been ill for a long time, we look like a mental patient, and they refer us to a psychiatrist. So when I was on Nightline, actually it was a few years ago when I was on Nightline, my explanation was that you do become a little mentally odd sometimes when you become environmentally ill. The doctor should lean in and say, I recognize what you have. You're a little loquacious, you're hypochondriacal. I think you're sensitive to perfume. I've asked you a few questions about mold exposure, and I think that you need an environmental physician. Not, oh my God, you have psych symptoms, I'm going to run away. Because that's not helpful to the patient, although I'm thinking that psychiatrists should be the first line of defense, as well as family practice physicians and general doctors, to pick up these people and not put them in therapy forever and ever, but help them therapeutically to get well by referring them and guiding them and comforting them while they're going through this stressful period. So we're all exposed to things we may not realize as signs and symptoms, so I'm going to tell you really quickly what they are. You may not like or become sensitive to or be sick around perfume, diesel exhaust, or the detergent aisle of the grocery store. You can get fatigue and muscle weakness, so washing your hair is exhausting, your arms are too tired, you can't fold a towel. You'll get memory loss, you may lose your ability to read well, and you may talk very fast. Clothing tags can itch the back of your neck, and when you get better, you won't need to cut the tags out anymore. The bra is too tight, you can't handle the pressure on the skin because the skin is ischemic, because there's a lack of oxygen, and this is due to damaged capillaries, and the endothelial cells are damaged from the chemical or the mold toxins in the bloodstream. Then the endothelial cells are swollen, I say in a casual way. I know there's data on this and research, but basically oxygen can't get in and out of the capillary. So the tissues and the muscles suffer mitochondrial damage due to lack of oxygen. So your muscles get weak, your brain doesn't function, your kidney may not function, all these end organs aren't getting enough oxygen. Rolling up your sleeves can be very painful because it's cutting off the blood to the arm. And these are obvious symptoms of very severe ER. Somebody published on fibromyalgia patients that the blood pressure cuff being blown up leads to pain, ischemic pain, and did a study. So there are studies that prove what I'm saying. Anxiety and hyperactivity or headaches on exposure to things like magazines, newspapers, nuts, wine, especially red wine, malls, tire stores which have rubber and benzene in them, intolerance of flying due to jet fuel, perfumes and magazines on the plane. It's a very small space, and you have all of these people with scents and odors and deodorant, and so people will get more dysautonomic and have more problems on a plane, but it just looks like a panic attack, because dysautonomia and panic are related in the literature. So they don't understand what's wrong, but they use Xanax to treat it. So a benzodiazepine will help treat dysautonomia and calm the person down and keep the heart rate slow and basically put them to sleep on the plane. The ability to smell pollution everywhere. The smell of driveways off-gassing. No city is tolerable once you become sick with very severe EI. And a lot of the patients move to mountains, near a lake, or the ocean. Hence why I'm on our here. Other common signs of EI. So basically everything you can think of, but I'm just going to list a few. Rashes. Peripheral neuropathy is extremely common with slow reduction velocities in the peripheral nerves, which can be measured at the neurologist's office. They can be sensitive to light and sounds, carpeted rooms, difficulty tolerating lots of foods. They'll get balance problems. They can't make a positive romper. If you close your eyes and try to push the patient, they'll fall over, and they won't be able to do heel-to-toe walking with their eyes closed, or stand on their toes with their eyes closed. They'll fall over. They look hypochondriacal because they have so many medical problems in so many different organ systems, it doesn't seem fathomable that it's real. People can become belligerent, especially men in a moldy home will act rude. They won't believe the wife when she's sick and saying, I'm chemically sensitive. The men will say, mold can't hurt you. And I don't know why this is such a common phenomenon, but I helped a couple thousand people when I was sick to talk on the phone and give them resources. And every single time, unless the man was severely chemically sensitive, the woman was having that they needed to leave the home, fix the home, dry out the basement, maybe get new clothing, and the couple really needs to work together in order to get well. So I advise people to bring the husband when they go for environmental treatment and get the husband tuned up as well. Otherwise, we have a sick woman and a husband who doesn't want to do what she needs to have done, and they can't work together, and they often divorce. As I mentioned, it can develop psychiatric issues, and you can become manic. And a very interesting example is wacky old women who wear too much perfume and don't realize the fact that they're chemically sensitive. And when I sit next to one of these women, it's a little hard because of the perfume, the pungentness of the perfume. But I gave a presentation at a senior center once, and a woman sitting next to me who was like 82 years old, she had a breakdown while I was talking, and she said, I was a teacher, and when I was 20, I got exposed for a day to a chemical in this little alcove in my teaching room, and nobody ever believed her, that she felt she was poisoned by the chemical, and that she hasn't been right ever since. And she wore a lot of perfume, and nobody in the audience really wanted to hear what she had to say after a while, because it was so distressing, and she was so kind of amusing. But truly, she'd been sick for 65 years with environmental illness, and until I did a presentation, it didn't dawn on her why she had had all these health problems. So, also diabetes and insulin resistance really can occur with people with mold exposure, and is a way really of looking at all of these chronic diseases in modern society and saying, well, instead of just medicating them, why don't we try to decrease their inflammation and detoxify them and help reduce the level of inflammation markers. And you can measure fibrinogen, CRP, the white blood count, and other things that are easy to follow over time and inexpensive. So here's a definition of chemical sensitivity. It's a multi-system disorder with multiple symptoms caused by adverse reactions to environmental excitants present in air, food, water, and habitats. It's modified by adaptation and by individual susceptibility, which means your genetics and also what you were exposed to as a child leads to your total load. So if you had more exposure through your mom when she was living in a moldy house, or had DDT exposure because of dancing in the fog of the DDT trucks, then when you're born and then when you're a child, you already have a high load. So you won't tolerate going to school in a moldy building as well as somebody who didn't grow up with that background or have fetal exposure. It's not a psychiatric condition, but it may have behavioral symptoms. And these are some of the diseases that are basically in the same basket, and autism is in the middle. So if people understood that society is having this major outbreak of autism with 1 in 50 kids, they would want to look at the etiologic agents so we don't have a society filled with impaired individuals that we can't afford to treat from birth until they're 70 years old. What are we going to do? So you would think that it would benefit society to have traditional researchers and physicians listen to people like me, who are doctors coming back from hell, to explain what we've learned. And I didn't create this field of environmental medicine. I'm just trying to be a messenger of what has occurred from the 1940s onward with the observation of good clinicians and how they treat patients. And I mentioned that there's a big overlap between chronic Lyme disease and environmental illness. And you really can't just have a practitioner who does just Lyme. It's not ethical to do just one disease. You have to be able to take a history and deal with what the patient's issues really are. And they may have a positive Lyme test, but they may have mold exposure at home. And I found that usually, if you take a history with a family with more than one person in the household with Lyme disease, they'll often have mold exposure first, damaged immune system, and then everybody ends up having had a tick bite, but manifesting chronic Lyme symptoms or a chronic Lyme test. But treatment with 3 years of antibiotics may not benefit that. So you can't necessarily get everybody well with antibiotics. You've got to look at all these other factors. We're all in a continuum from 1 to 10 of being affected by the environment. Nobody's a 0. It's how you deal with exposures that makes people more or less environmentally ill. How do you become environmentally ill? So I think I've already touched on this. But a big exposure leads to intolerance to other chemicals, molds, pollens, danders, and foods. Chemicals from carpeting, Xerox machines, furniture, these could be a source of illness. And a person could just get new kitchen cabinets with high formaldehyde in the cabinetry and become chemically sensitive and completely disabled for the rest of their life. So it really matters when you renovate, what are you going to put in the house? So there are other chemicals produced that are biologic agents, and these are called mycotoxins if they're from fungi. I will show you how to test for these in a minute. A few hours in an extremely moldy room could ruin your life. You could become intolerant of everything else just by renting or buying a house, going in and realizing you can't stay there anymore, but the damage is done. You've absorbed these mycotoxins, they're in your fat, they're in your brain, they're in your spinal cord, and until you get them out, you won't recover. Environmental medicine is a field not yet accepted by the AMA. It promotes the individualized treatment of people by figuring out the cause of their illness. The 75-year history of the field is very interesting. It began with Ringel, then Randolph, and then Dr. Ray, who's still alive and treating people in Dallas. Dr. Ray has treated 30,000 people, of which I am one. The Society for Clinical Ecology changed its name to the American Academy of Environmental Medicine a decade or two ago. You can go to AAEM.com to find a doctor. And the website for Dallas is ehcd.com. Here's the book, 4-volume set on chemical sensitivity, written by Bill Ray. Many thousands of pages. I think he'll definitely get a Nobel Prize at some point for his work, although he's not been appreciated at this time. And environmental medicine is really a misnomer. It's not just about toxins. It's about all of these different factors. So people think, oh, I don't have a toxic issue, I'm going to tune out. But it really has to do with nutritional issues, hormone, the effects of endocrine disruptors on the hormones, infectious agents, including Lyme and other viruses, genetics, EMF exposure, altitude and how that affects the body, and other issues with biochemistry. People hear the word environmental and just get turned off, which is just not fair. I mean, it doesn't matter what we call it, the theory is still good. And this is my umbrella saying that environmental medicine, or whatever we want to call it, we could call it comprehensive medicine. It really encompasses all of these other fields. And allopathic medicine is the stalk to the umbrella. So yes, we all need to learn about allopathic medicine and understand basic diseases and basic treatments, because people come in with these medications and these diseases, we need to know about them. But all these other fields, including Lyme and autism medicine, people who are trained in energy medicine, they are all valid. And we have to stop being snobs and saying, we don't want to learn about those crazy doctors and what they have to know. These are the doctors who often got sick and really know more than traditional medicine about how to get well. Doris Rapp has written 5 best-selling books on children and environmental health, and was on Oprah and Phil Donahue many times in the 1980s. Yet nothing that she has done has really become mainstream yet, except the bisphenol A issue she has been talking about for 10 or 20 years. And finally, BPA is out of baby bottles in Canada, and we're getting it out of plastics here. But does anybody know that Doris Rapp deserves the credit for that? No. So I mentioned that I was on Nightline, and you can see it on YouTube, and you put in Nightline and my name. And the clinic in Dallas and Bill Ray are there as well. Plain Dealer wrote an article, and they gave a front page section of the Science Times on environmental health and how the green movement is giving a boost to this field. I spoke at the Cleveland Clinic, and they wrote me up. And Cornell Medical School just published an article, what I really like the title, it's called Believe the Patient. And I said that the neurologist there, Plum and Posner, taught me when a patient comes in with bizarre complaints, believe the patient. And some lady came in and she was flailing her arms when she went through doorways. And everybody thought she was crazy. And actually she had a thalamic tumor where she interpreted space in a strange way. When she felt enclosed, she would flail and have kinetic movements that were abnormal. And I bet Plum and Posner didn't know that I would be quoting them today to say that that way of thinking, of not being cynical and assuming that the doctor knows everything, is the way you need to think. You should always believe the patient and never think the patient is willing to wring his hat off and people want to come to the doctor to fake an illness. They want to be well. People do not want to fake to get disability. They want to work and be productive members of society. So the fact that it says, after toxic mold made her sick, I have devoted my career to validating and treating environmental illness. It's amazing they put toxic mold in Cornell Medical Alumni Magazine. My story in brief is that I lived in Los Angeles, and we had a very large aquarium of 5,000 gallons, and the shed around the aquarium covered up the air intake for the house. And the toxins produced by the wood and water, these mold toxins, were brought into the house and poisoned the doctor who sold me the house. And he had issues, and he lost his license, and he almost died from undiagnosed pneumonia. And we moved in, bought the house, thought we were fine, and then I started to fall apart and got weak muscles, couldn't really cut a vegetable, couldn't fold a towel, couldn't brush my teeth, couldn't intubate in the emergency room because my muscles were so weak, the nurse would pull up on the scope. But I didn't know I was sick. I thought I was depressed and just wanted to stay in a bathrobe all day. Because I'm traditionally trained, I didn't even recognize what was going on in my own medical situation. So, as she said, I developed Addison's disease, severe dysautonomia, anoxic damage to the mitochondria by electron microscopy, and chemical and severe electrical sensitivity. It looked like I had Lou Gehrig's disease. The neurologist said, I think this is what you have, not sure what to do, and I knew I had 30 days left. So I went to a meeting on chemical sensitivity because I found something on the internet about it, and I went to a meeting doused in perfume. And they were at a banquet for the evening, and they said, "Are you wearing perfume?" I said, "Oh, I just want to put some more on." So I was so out of the loop of what environmental illness was about because I had been trained traditionally, and it was really almost my downfall. I met Bill Ray, he gave a lecture. I said, "I think I'm dying. You're the only physician here who treats patients. Where do you work?" And I followed him to Dallas, and I was there for 3 months. Symptoms of adrenal insufficiency, which is one of the biggest, easiest problems to fix. You get dizzy from tying your shoe when you get up quickly, you have trouble with maintaining your blood pressure, and you get a sort of a woo feeling. You have motion sickness in vehicles, fear of heights or ladders, hyperpigmentation on the face or legs. You can get dark changes in the gums, and I'll show a picture. You can crave salt and sugar. You get frequent headaches, intolerance of fingernails on a blackboard or fork in a pan, you just drive you crazy. Beeping noises, lights, irritating situations, spouse, you just can't tolerate any stress. Blood pressure of 100/60 is thought to be almost diagnostic of insufficient, mildly insufficient adrenal function. Thin body, some people can be overweight and have low adrenal function, but a recent weight loss of 10 to 25 pounds is very common in people with Addison's disease. History of being a tan, thin child, and having difficulty standing up. Difficulty getting up in the morning, hitting the snooze button many times. So as a child, I had all of these symptoms. Exhausted at 4 p.m. and may need a nap. Here's the picture. So on the right, it's very hard to see, but that's all pink. Those gums below the teeth are pink. And on the left is the abnormal patient who has changes right here. This is purple, purple, purple. And this is somebody with full-blown Addison's. You can even see there's hyperpigmentation, dark marks here. And the facial skin has a lot of pigment in it. And this is me, actually. So I used to have brown marks all over my face for 5 or 10 years. In my 30s and until I was 40 and diagnosed. And then when I was put on cortisol or hydrocortisone, the dark marks go away. And if I don't take enough, I start getting hyperpigmentation again. Here's a saliva test showing what a normal cortisol curve should be. 4 tests during the day, and you have high cortisol in the morning to get you up and be happy, and then the cortisol slowly goes down to about 0 or 1 at midnight. You see in a patient, this is probably me, this patient has a morning cortisol that is no longer up here, but is way down here. So this is consistent with somebody who probably has Addison's disease, not just mildly weak adrenals. Somebody who has weak adrenals, maybe it'll be here or here, but when you become flatlined and very low and almost 0, that person's not making hardly any cortisol, and it'll kill you. So my favorite study that I quote is in 1988, Thurman in the Army did a study on rats. They were exposed to the trichosithines in the air. The rats were breathing moldy air. They got adrenal necrosis and they died, but only the females. Later, Thurman proved in another study that if he gave testosterone first to the female rats, it prevented the adrenal damage and the rats lived. And this is what we see in humans. It's what we see in chronic fatigue syndrome, some of which is caused by mold exposure. So the adrenal gland is stressed. It controls allergy. blood pressure, mood, ability to tolerate all of these bombardments of the modern age. And it's very often the culprit making you feel fatigued when you have this condition. We want to compare toxin levels to the decreased adrenal function, and this is my priority for the easy first research we should do. Okay, POTS. POTS means you stand up and you get a fast heartbeat, and when you lay down, it's slower. The treatment is, the diagnosis is made by doing a tilt table test. Is there any chance that person can find their phone? Somebody needs to find the telephone that's ringing. Thanks. Okay, so it's just hard for me to concentrate with that. The noise in the background, sorry. So people can have headaches from POTS. They can get nausea. They can feel like their legs are heavy. They don't want to stand up and do things. They don't feel energetic because the nervous system and the brain stem through the spinal cord isn't telling the nerves to the veins to constrict the veins. So the veins are dilated, and the blood is in the legs, and then if you eat a big meal, the blood is in the gut. So people who eat a big meal and fall asleep afterwards often have dysautonomia or POTS. And this is a common thing that happens with environmental exposure, as it did in me. It happens in females 5 to 1, and the patients are often labeled anxious or neurotic or having panic attacks. So here's the history and need to obtain. When you lie down, do you lie down and get very tired after eating? Do you not like to stand up? Do you lean against the wall, fold your arms, cross your legs when you stand up? Do you pretzel your legs in a shape like this when you're sitting? When you use the computer, do you pretzel your legs more? When you go to a store, do you feel fatigued, like you want to be in a wheelchair, you want to sit down? Because the VOCs, the organic chemicals in the air, increase the dysautonomia. And this has been documented that air pollution, Dr. Christiani at Harvard did this, that air pollution leads to autonomic changes. So indoor air pollution, outdoor air pollution, doesn't really matter. It proves that you get changes in the autonomic nervous system, and the data is already there. We don't need to recreate the wheel. We need to look at the existing data and put it together with clinical pictures of patients and say, oh, so let's put the person in clean air and they'll feel better. Or give them a mask if they have to go to a store and filter out the VOCs so they can go shopping without wanting to faint. As a kid, did you have to study laying down because you couldn't sit up and stay awake? Do your arms feel a little blue or ruddy? And I'm going to show you a picture of this. Is talking exhausting because the blood won't fill the heart? And you keep talking, you're pushing the blood out of the heart, it won't fill. You feel like you just want to relax and take a deep breath because you're pushing the blood out constantly and you always feel like you're on the edge of keeling over. So you look anxious, you're always releasing adrenaline, and you can't slow down because you feel like if you slow down, the person you're talking to will not be patient and wait for you to catch up. So here's a picture of the ruddy legs. And you can see they look pretty similar, but you can get a bluish or a reddish discoloration. And on the, let's see, this is the side. This is darker than this side. So this is more of a tan look. And this is all the blood vessels at the capillary level dilated, making these legs more, they have venous pooling. And you really have to be attuned to it. A cardiovascular expert may not even notice it. So here's some studies that I did. I performed a tilt table test at Beth Israel on most of my patients who had mold exposure or complaints of fatigue. And if they had a fast heartbeat in the office, 20 beats faster, I would tilt them. Even if the tilt isn't positive, it's a good thing to document every single patient. Most of the patients, 80% of the patients, went up by 30 beats in the first 10 minutes of the tilt. They just tilt them at 45 degrees and let them lay there. And the blood goes down into the legs and the heart starts going fast. 30% of those patients will also have pre-syncope and want to pass out and may drop their blood pressure. Some people get a slow heart rate, but a majority just feel lightheaded, nauseated, stop the tilt, they don't want to do it anymore. So I was talking to Bill Ray. He said that he thinks 60% or 70% of the patients now who have environmental illness is due to mold. It's very common. As I mentioned, he's treated many thousands of patients, and any of you who want to, if you're a physician and you would like to go study with him, I recommend that you call him, you don't go down in perfume clothes, and you go unscented, and he'll take anybody who wants to learn being treated by the masters, and really the field has to continue. And I'm going to skip through some of these articles because you don't need to know all of the data, but it'll be here for the future. I'll put the PowerPoint up on the internet. And there are a lot of studies about mold and mycotoxins looking at neurologic disease, antibodies to the nervous system from mold exposure. So you make an antibody to myelin or sulfatide or ganglioside, and that person may develop MS, but if you get them early, you can treat them so they don't develop the disease associated with those antibodies to the nervous system. Kilborn published a book. It's a very good set of articles about the psychological and electrocortical effects of mixed mold exposure. They noticed that the EEG was different, natural killer cells were different, immune suppression, and SPECT scanning showed damage. This is not anecdotal. They studied hundreds of patients living in wet buildings, moist buildings. And we covered this. They also discussed blink reflex, color discrimination, visual contrast impairment. These are all things that have been documented to occur in mold patients. The 3 toxins we can measure are in bold: aflatoxin, ochratoxin, and the trichocythides. The company that does the testing, it's called Real-Time Labs, and the testing is not inexpensive, but it is covered oftentimes by Blue Cross and other insurance companies, though not Medicare. So you send a urine sample and you get a result of what level you have. And then aflatoxin is the rarest, ochratoxin is the most common, I would say, and trichocythides may be considered the worst family of toxins, and is clearly a bioterrorism agent that a lot has been published about. This is a list of many toxins you could find in a sample of house dust. So you see there are many, hundreds if not thousands of different types of toxins. You can't measure them all. We have a test that measures 3 groups. That's as good as we come. I did a pilot study after I found a family I was treating had real-time tests where the urine mycotoxins went up, but they had left their moldy house. They got new clothes, they got new cars, they had money to do all of that. Why did the mold toxins go up in the urine when they kept doing testing every 3 months? And I realized they were starting to do sauna as a family, more so the mother and the 2 children. The husband, of course, felt he didn't need to do it. And his toxin level did not go up. It sort of stayed 0. So what happened was, I thought perhaps they were getting the toxins out because of sauna, and that was making it look like they were getting worse, but actually they were detoxifying and bringing the toxins out to the urine. And so I found that studying people the same day, before and after sauna, shows that the toxins come out in the urine. And if you want to get a positive test, you would do it after the sauna. Because a $700 test that shows 000 is not that useful if it's a false negative. So I freeze the urine and do a pre-sauna and hold it if they can't afford to run both. And this patient, the same day, 000. And the next day, the next test, ochratoxin went up to 2.8, which is positive. Aflatoxin was very high at 6.8, and the trichocythides is 0.6, and anything above 0.2 is positive on trichocythides. So you see it's positive, 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 the same day in the same patient. So I think I've made my small contribution to scientific experimentation by figuring out that if you want to get a test with a good yield, you'll urinate first, do a 30-minute sauna, wait an hour for that toxic urine to collect into the bladder, and then collect it, and then send that test off. If later you want to compare to the rest of the people in the country that have done a test without the sauna, then you can do the other test to prove that it was lower or 0. But it definitely proves that sauna may be a good method for detoxification and excretion of some mold toxins, and more studies should be done in this area. I'm going to review a little bit of data. So I'm going to continue, just because we started late, I'll continue until I get the flag. Chronic fatigue syndrome, a very good study was done by Dr. Barani years ago, and he took spinal fluid from Gulf War syndrome patients with fibro and chronic fatigue, many of whom were chemically sensitive. He found that 20 proteins never occurred in normal people, but occurred in these sick individuals. The 5 proteins gave 80% predictability of chronic fatigue as a diagnosis. And in conclusion, he said that the identical set of proteins found in these patients indicated presumably a shared pathologic mechanism. So the diseases are similar, if not the same. And obviously, different causes for each of these syndromes, Gulf War syndrome may have been one issue or a set of issues. It may be different than the mold issue, but they may have the same mechanistic behavior. He did a new study last month, and it showed that diffusion tensor imaging highlights bundles of nerves, or white matter, connecting the brain regions, and found abnormalities in 31 vets compared to normals. So he just published this in the British, I'm not sure what this is, the BMC Neurology. And if anybody says there's no data, they're wrong. They need to basically learn what data is out there by having somebody speak to them and present data. There's so much data in different areas of environmental exposure, you couldn't possibly present this quickly. The genetics of detoxification, 4 genes. The middle one is GSTM1, that's glutathione transferase 1. That and these other genes are very commonly abnormal in people who cannot tolerate chemicals. So if you have no ability to make glutathione well, or less of an ability, and glutathione is a major detoxifier, and you're sick, then you want to replace glutathione in the patient. And you can do it intravenously, you can do topical skin cream, you can take oral N-acetylcysteine, and this is used in traditional medicine for Tylenol overdose. NAC is given to save people with Tylenol overdose from getting a liver that needs to be transplanted. You'll die from Tylenol OD unless you give NAC. So what is the big stretch to realize that other toxins also benefit in the ability to be excreted and broken down besides Tylenol? There's a mouse model of chemical sensitivity, and I will not go into it, but there is proof that you can create a chemically sensitive mouse. Pesticide exposure can lead to diabetes and obesity. And not only is pesticides can make you fat, but a new article came out this week that says flame retardants can make children fat as well. So in terms of engaging Michelle Obama on the issue of obesity, it's not only exercise, it's also toxicity and healthy eating so that you can detoxify. And if you have genetics that are poor, how do you enhance detoxification in somebody who doesn't have as good of a chance as somebody else? Oh, did you want to write something down?
No, I will say thank you.
So the biomarkers of chemical sensitivity are many, and I really won't go into everything right now, but it is obviously an area where we need more research to say what things can we measure besides heart rate variability and a tilt table test, measurements of peripheral nerve function, pulmonary function, T-cell subsets, antibodies to chemicals, autoimmune markers. These are all things that are abnormal in people who are exposed, and they become normal when the patients are treated. Very interesting article. This is on the cell phone issue. 13,000 women were investigated in the United Kingdom, and this is not last month, this is actually a few years ago. They had a 30% incidence in behavioral problems in mothers who used a cell phone 3 times a day. ADD, autism, and other behavioral issues. So implying that cell phones should not be used, that's used, not used during pregnancy. I deal with people in the building biology area. They're interested in mitigating electrical exposure in the home, chemical exposure in the home, mold exposure in the home, having adequate dehumidification of the home, and air exchange. The issue of EMF sensitivity is paramount. It sounds strange, but having become sensitive to electrical appliances when I got sick, it's horrifying. I couldn't even pick up a cell phone and put it in my head. I would get headaches, I would sweat from the arms, I would get chest tightness, and I would get decreased blood flow to the brain. So I recommend using an air tubing headset that you can get on Amazon. ENVI is the company. You plug it into your iPhone, you put the iPhone 2 feet away, and you can communicate with the world. I never hold my cell phone, and I never put it up to my head. Because where I went, I don't want to go back, I don't want to get sick, and sometimes I'll get mild symptoms if I hold the phone, it'll heat up in my hand. And that is mild electrical sensitivity, which I bet many people in the audience experience. Bisphenol A creates problems in 2-year-old children. Well, this is, news, but the problem is, what are we doing about it? Why does it take so long to change the products that we use? And the problem is money. People have to financial incentive to meet the public demand to change products that are less toxic. Now, I was on the CDC's National Conversation on Chemicals and Public Health, which is a group that met for 2 years every month by phone or in person, and these are 3 recommendations that I helped write. That we want to improve the understanding of the individual susceptibility to chemical exposures, we want to look at gene-environment interactions, and we want to look at the potential health impact of indoor air quality during fetal and child development. Linda Birnbaum is also familiar with this. The concepts that I'm trying to present to her, I feel were just brought out in her new mission statement, that NIEHS, the group at NIH that is focused on environmental chemical exposure, they need to look at multiple exposures at the same time, not just one chemical at a time, and also low-dose exposures. It's not about the height of chemical exposure is always going to make a sicker person. She realizes that low-dose exposure can create significant impairment, and her focus was on flame retardants. So the one thing we accomplished by this recommendation is to say that we need a place, a hospital, to do research on these patients because we need a building that is chemical-free. So we don't have anywhere in the country, except for Bill Ray's clinic, where the air is filtered, the walls and floors are tile or porcelain, and patients who are sensitive can be tested and can improve. So I mentioned that research on autism needs to occur quickly because obviously the rate is increasing exponentially. And Martha Herbert at Harvard and Claudia Miller in Texas have been lecturing for years on autism and the relationship to chemicals and mold exposure in the mother. While the mom's pregnant, living in a moldy house, you can produce an autistic child who's chemically sensitive, and they can be ameliorated by environmental medicine treatment. And I mentioned these are their names. And also Dr. Kaplan Patel has also done a lot of work and published an article on the environmental treatment of the autistic child. And I'm going to finish, I'm just going to flip through and see if there's anything else that I really want to impress upon you. The treatment of the environmental patient slide is what I'm going to just, this is environmental medicine treatment. So you get away from the exposure, leaving the worker home if it's mold. It's hard to remediate and live there once your immune system is sensitized. Most of us have to leave and get a new place to live. Read Edelson about environmental illness. Reduce your total load in air, food, and water. So glass bottles, I tell everybody they need to order Mountain Valley water, but I have no stock of Mountain Valley water. They deliver it in 5 gallons in all cities in the United States. You need to put a charcoal air filter in your room and have sleep all night long with less chemicals. And you need to eat food that has less pesticides and maybe even rotate the food on a 4-day rotation. So you don't have the same food every day, because then you become allergic to it. You can strengthen the person with IV vitamins to get the liver ready for detoxification. Fix all the hormones. Treat nutritional deficiencies. Deal with allergens. Use sauna to get the toxins out, cholestyrene and oxygen therapy. And cholestyrene binds mold toxins, and oxygen therapy can be gone into in more depth on my website. Provocation and neutralization allergy testing, which competes with traditional allergy. We don't know how it works. So we've had a battle for 30 years about provocation and neutralization that it won't be covered by insurance. And then ALF is an immune system booster that's available only in Dallas to boost lymphocyte function. And this is how you decrease the total load, and the slide will be available for future observation. And this is a safe room, which a very chemically sensitive patient may dream about. A room covered in foil with an air filter. It looks horrific, but actually it works. This is a man in a sauna. This is the book by Edelson. It's on Amazon, very inexpensive. I would buy it today. And finally, let's discuss why we can't teach this in the Harvard Medical School system. The Brigham had an episode, maybe 15 or 20 years ago, about nurses who got sick on the 8th floor from chemical sensitivity. And some of the nurses got sick, and some of them may have died, and they all had lawsuits, and they're still being treated, and they're still disabled. So if a medical school has litigation and financial interest in preventing the information to get out to their new students because of old problems, we see that there's always a financial reason why we don't want to let the information out. And that time has passed. Even if they lose $1 million on a poor nurse who's sick and she gets a settlement, it's time to teach the med students at Harvard and Penn and Cornell about what we have learned from integrative and functional medicine and environmental medicine and the Lyme and the autism experts, so that a doctor can take a great history and figure out what the heck is wrong with you and get you on the road to recovery without worrying about who it's going to offend in some department that doesn't agree. So we should not perpetuate the wrongs that have been done to those who have been injured, and we should promote cutting-edge research. And ignoring mold would be foolhardy. And I'm working at the Mass Medical Society as a delegate. I'm trying to change AMA policy. I'm working on EPA, CDC, and NIH. I have a meeting at NIH that everybody should invite somebody to. There's a website to log on to. It's called HIVR. And it has to do with Health in Buildings Roundtable. And we're having a meeting on how to mitigate health problems in people by creating safe housing in schools and workplaces. It's the first meeting ever at NIH. I'd like the media to be there. I'd like anybody influential to be there. And I'll be speaking, and then other famous people will be talking about their aspects of health in buildings from the architecture point of view, from the money point of view, why needs to look at health credits, not just green building, but healthy building. And obviously, medical school curriculum needs to change, and public health departments need to work with environmental physicians and invite us to educate them, and then we can all work together to improve the situation. Thanks very much for having me speak, and here's my contact information.